Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Fariha Saleem, and the topic of discussion today is circulation of blood. So we have completed heart, and today we are going to start circulation. Basically, circulation is the movement of blood through the heart and blood vessels. Okay, if we talk about the types of circulation, there are two types of circulation in the body. The first one is pulmonary, the second one is systemic. We will study both these circulations in detail. Although the circulation around a body is continuous, but it is really convenient if we divide it into these two parts. Okay, let's go through some very major arteries. First one is right common carotid artery, and just below it, above the clavicle, is right subclavian artery. After that, you can appreciate the brachiocephalic artery, the right axial artery, the right brachial artery, right radial artery, right ulnar artery. And on this side, the left side is left common carotid artery, left subclavicle artery, arch of aorta, the thoracic aorta, abdominal aorta, left common iliac artery, left femoral artery, left anterior tibial artery, left posterior tibial artery, and dorsal pedis artery. You should know the major arteries of our body. So basically these are the aorta and the main arteries of the limbs. Next, we come to the major veins of the body. There is the left subclavian vein, the right subclavian vein, right brachiocephalic vein, right axillary vein. In the same way, they are paired. There are some of the, you should know that some of the arteries and veins in our body are paired and some are unpaired. These ones, like the right axillary vein, the right cephalic vein, the right brachial vein, they are all paired. The right radial vein, right medial vein, right ulnar vein, right cephalic vein. Okay, and just you can appreciate on the leg part and on the foot there is right anterior tibial vein and right posterior tibial vein. Okay, so in this diagram, the superficial veins are denoted by light blue color, and the deep veins which are present deep within our body, they are denoted by dark blue color. Okay, so now we come to pulmonary circulation. Pulmonary circulation is basically the circulation of blood from the right ventricle of the heart to the lungs and back to the left atrium. If you can recall the diagram of our heart, there is right atrium, below it is the right ventricle, on the left side above is the left atrium and below is the left ventricle. So the pulmonary circulation is that type of circulation in which blood circulates from the right ventricle of the heart to the lungs, and then the oxygenated blood comes back to the heart into the left atrium. In lungs, the carbon dioxide is excreted out and oxygen is absorbed in the blood. Now the pulmonary artery, or the trunk, which carries the deoxygenated blood. Here it's very important that normally all the arteries in our body, they carry the oxygenated blood, but this is an exception, that the pulmonary artery, it carries the deoxygenated blood. So the pulmonary artery, which leaves the right ventricle, it carries the deoxygenated blood and leaves the upper part of the right ventricle of the heart. Then it passes upward and divides into left and right pulmonary arteries at the level of fifth thoracic vertebra. Okay, now these arteries, the pulmonary artery, they basically divide into right and left pulmonary artery. The left pulmonary artery runs to the root of the left lung, where it divides into two branches. And the right pulmonary artery passes to the root of the right lung, and again it also divides into two branches. Within the lungs, these arteries, they divide and subdivide into smaller arterioles, and capillaries, so that the exchange of blood is much more easier as compared to a vessel with a wider diameter. Now the exchange of gases takes place between the capillary blood and the air in alveoli. Uh, you might have noticed in previous lectures the structure of alveoli. It's like a balloon, but its outer layer is very thin so that easily exchange of gases can take place between the blood and the air. In each lung, the capillaries contain oxygenated blood, join up, and eventually form the two pulmonary veins. Now, all the capillaries which are carrying the oxygenated blood, they will form a pulmonary vein. Now, again, the veins in the blood in our body, they contain the deoxygenated blood, but this is an exception. That pulmonary vein carries the oxygenated blood. Now these pulmonary veins, they leave each lung, returning the oxygenated blood to the left atrium of the heart during the atrial systole. Now when the atrium will contract, this oxygenated blood will be passed on to the right to the left ventricle. Okay, and during the ventricular systole, that is during the ventricular contraction, this oxygenated blood will be transported from the left ventricle towards the whole body through aorta. Okay, so this was the you can say in informal term we can say that this was the first part of circulation, that is when the blood is being oxygenated. Now the second part of the circulation is systemic circulation. Now we need this oxygenated blood to be transported to whole of our body. So systemic circulation is also called as general circulation. The blood pumped out from the left ventricle is carried by the branches of the aorta around the body and returns to the right atrium of the heart by superior and inferior vena cava. Okay, so now we have to understand that when the blood leaves the left ventricle and it enters in our whole body and come back to the right atrium. Now this part is called as general circulation or systemic circulation, in which our blood is moving throughout our whole body. Okay, the circulation of blood can be divided into two parts, and these are further later on discussed. Okay, firstly we will discuss the aorta, because when the blood leaves our heart, it enters the aorta. So what is aorta? Aorta begins at the upper part of the left ventricle, and after passing upward for a short way, it arches backward and to the left. So it leaves, this aorta is a wider artery, you can say, which leaves the left ventricle. It then descends behind the heart through the thoracic cavity a little to the left of the thoracic vertebra. So this is basically anatomy of the aorta. At the level of the 12th thoracic vertebra, it passes behind the diaphragm and then downwards into the abdominal cavity to the left to the level of the 4th lumbar vertebra, where it divides into right and left common iliac arteries. You can understand this whole paragraph with the help of this diagram. Okay, the arch of aorta you can appreciate just behind the upper part of the heart. This arch of aorta is dividing into brachiocephalic artery. We will later on read about it, and below it is further being divided into renal arteries at the level of 12th thoracic vertebra. Okay, throughout its length, the aorta gives off numerous branches. Some of the branches are paired, that is, there is a right and left branch of the same name. For instance, the right and left renal arteries, which are supplying the kidneys, but some of them are unpaired, like celiac artery. We have already discussed that some of the arteries in our body, they are paired, that is, they have a right and left part, but some of the arteries, they are unpaired. Okay, so aorta was later on further divided into thoracic aorta and abdominal aorta. We will cover thoracic aorta today. This part of the aorta lies above the diaphragm and is described in three parts. First one is ascending aorta. Second one is arch of aorta. Third one is descending aorta in the thorax. First one is ascending aorta. Now look at this diagram. This is the short section of the aorta that rises from the heart. It is about 5 centimeter long and lies behind the sternum. Okay, so ascending aorta, ascending means it is going upwards. Okay, so it rises from the heart, it is just 5 centimeter long and it lies behind the sternum. The right and left coronary arteries are its only branches and they arise from the aorta just above the level of the aortic valve. Okay, so from the ascending aorta rises the right and left coronary arteries. They are important arterial supply to the myocardium, that is, these right and left coronary arteries supply the muscle of the heart. This is an important MCQ. Okay, so arch of aorta. The arch of aorta is a continuation of the ascending aorta. It begins behind the manubrium of the sternum and runs upward, backward, to the left in front of the trachea. It then passes downward to the left of the trachea and is continuous with the descending aorta. 3 branches are given off from its upper aspect. The first one is brachiocephalic artery. Second one is left common carotid artery. Third one is left subclavian artery. Okay, again you can appreciate it over here. From the arch of aorta is rising the brachiocephalic artery. Okay, right and left. Next is the left common carotid artery. You can also see it on the left side, and then the left subclavian artery. All of these are arising from the arch of aorta. The brachiocephalic artery is about 4 to 5 centimeter long and it passes obliquely upwards, backwards to the right. At the level of the sternoclavicular joint, it divides into right common carotid artery and right subclavian artery. Okay, circulation of blood to the head and neck. Okay, now we will study these 2 diagrams and we will be done for today. The paired arteries supplying the head and neck are common carotid artery and the vertebral arteries. Okay, you can see on the right side there is a superficial temporal artery which is supplying the temporal area. Next is the maxillary artery which is supplying the maxillary bone area, and it supplies many teeth as well. The facial artery, you can see it is obliquely running from the nose region towards the angle of the mandible. Next is the lingual artery which supplies the tongue and some teeth, lower teeth as well. The superior thyroid artery. On the left side we can see that there is occipital artery supplying the back of the head. There is external carotid artery supplying the neck region, internal carotid artery and common carotid artery. And the neck region is being supplied by right vertebral artery and right subclavian artery. So that is all for today. Today we have discussed the 2 types of circulation which were pulmonary and systemic. Systemic is also called as general circulation. We discussed the main arteries of the body. We discussed about the main veins of the body. Some deep veins, some were superficial veins. Then we discussed the pulmonary circulation in detail. There were pulmonary artery, pulmonary veins. Pulmonary arteries were further divided into right and left. Then we discussed about the systemic circulation, how the aorta branches off from the heart, what are the parts of aorta. Then we discussed about the thoracic aorta and its parts, that were ascending aorta, the arch of aorta. Then we discussed about the branches, arterial branches or supply of the head and neck. So I hope it is clear for today. Thank you so much.